dear viewers everywhere. It's my pleasure to host a program in the outpatient clinic today, hosting a very important topic in medicine for all of you. My name is Imad Bishay. I'm board certified internist at Palomar Hospital and Tri-City Hospital in beautiful San Diego. And it's my honor and privilege to have a distinguished speaker in the heart disease, Dr. Mikhail Malek. He's the director of Cath Lab at Palomar Hospital, San Diego, as well as he's board certified in interventional cardiology and internal medicine. He will talk to us about the heart disease and risk factor for coronary heart disease. Welcome, Dr. Malek. It's my pleasure to have you here.
Thank you very much for having me. I hope our program today will be beneficial for a lot of your audience.
Great. It's my pleasure. And as you know, the heart is the core of the body, the center of the body. We cannot live without a heart.
Yes, that's true. And actually, coronary artery disease is very prevalent in America. There are about 13.5 million people with coronary artery disease living in the United States. And the important part that it is preventable disease, and we usually like to educate the people to prevent it. It's better than wait. Then you get the disease, then you look for the treatment.
Great. Stay tuned, our viewers. We're going to show a lot of slides, beautiful pictures. We're going to educate you, and I'm very excited myself to be in this program. So let's talk, Dr. Malik, about the risk factors. Who could get a heart attack or heart disease or coronary disease? Who's more liable to have that?
Okay, we have several risk factors which are well known and documented, like the age. The older we get more of the atherosclerosis or hardening of the arteries. The family history is very important. People who smoke, the high blood pressure, the high cholesterol, the low HDL, diabetes mellitus, hypercholesterolemia, sedentary life, and these are the documented, the most important risk factors. How did we know that these are the risk factors are deleterious to our health? So that goes back to Framingham Heart Study, and Framingham is a city in Massachusetts.
As you can see on the map, we're going to show it. Yeah.
As in the map here in Massachusetts. This study was started in the 1940s, and about 5,000 people participated in this study. It was a voluntary study, and we call it observational study, so they don't get any treatment. It's just observation. So this 5,000 plus people agreed to fill up questionnaire twice a year, and they go and get some blood test, and they get physical exam periodically. And we learned a lot from this Framingham study. We see their generation now. I think there are third and fourth generation are being still followed, and more than 1,000 article was published based on the Framingham study. So basically, they monitor people and they see what will happen to them. So they found that people who smokes, they get more coronary artery disease and they get more strokes. So that's the reason in 1960s we learned that, and the general surgeon said that smoking is deleterious, and that's how we knew that smoking was bad for our health. Then in 1970s, they found that the people with high blood pressure, they get more strokes. So when they treat their high blood pressure, the stroke rate dropped. So we learned that high blood pressure can cause stroke. And then in 1980s, we found out the people who has high HDL, the good type of cholesterol, they get less heart attacks and stroke. So that's how we knew that HDL is good. So that's how we got to know these risk factors, and that's how we evaluate the patients. When they come, we need to know if they are high risk or low risk for coronary artery disease.
Great. So we've talked about the age, diabetes, sedentary lifestyle, hypercholesterolemia or hyperlipidemia. And some of these we can fix, but some we can't, like the age.
Exactly.
So in this slide, I think you're going to show us that some of
Yeah.
it, and it's a good time to spend a minute telling the smokers, please try to stop smoking.
Yes. So, as you mentioned, that there are two types of risk factors: correctable factors and non-correctable factors.
Mm.
Like family history, we have no control of that.
Mm.
Age, we have no control, but
Correct.
we have control on high cholesterol, about high blood pressure, about the smoking, about the diabetes, about the excess weight, and the lack of physical activities. And these are the items here in this slide, and you can see it and try to memorize it.
Great. So how does a clot form? What's the pathology behind this? And we can show every viewer the normal heart, how it works, and kind of know how this clot forms, how we end up with a heart attack. But before we do that, let's go on a short break. Dear viewers, stay tuned. After this break, Dr. Malek will answer this very important question.
When I was young, I used to love to find the paper dolls inside McCall's magazines. And one day I was pondering the Galatians 5:22 and 23 verses about the different fruits of the Spirit, and I decided to put together a series of paper doll books for each of the fruits. And I began with love. Anna Maria is the first doll, and she is matched with a rose as a symbol of love. I hope young children and women my age will enjoy the resurrected craft of paper dolls. Anna Maria Fruit of the Spirit paper doll can be purchased on Amazon.com, CinderellaFactory.com, or at your favorite bookstore.
Dear viewers, we're back with a very important question. Before the break, I asked Dr. Malek about the normal heart and how the clot is formed.
Yeah, if we look at the
Slide.
slide here, this is the normal heart, and as you know, the heart muscle has a coronary arteries, has very small arteries supplying the heart muscle. So although there are blood inside the heart, but the heart muscle does not get its nutrition from the circulating blood. It comes from these small arteries, which we call it coronary arteries. So we have the artery in front of the heart, which is one of the most important arteries. Then we have the circumflex artery, which goes behind the heart, and we have the right coronary artery. So when we look at this artery, they are very small and they are in the heart. But actually, we always talk about the cardiovascular system because all the arteries are networking. The
As
arteries,
we can see in this slide.
as we can see in this slide, you see the heart pump the blood to the brain, to the aorta, to the kidneys, to the limbs. So all these arteries are very important, and we have to keep this artery healthy. So when sometimes look at this picture here, which sometimes it's fascinating how
lots of highways and bridges and
and
wow.
cars going in
Right
one
and left
direction, and they don't do that. So sometimes we look at this and we are amazed, but we forget that our body has more complicated and more sophisticated program and complexity than what we see. So if you look at our body and you take the aorta, then the branches, then the capillaries, then the venules and the veins, and back to the heart.
The whole circulatory system,
Yes,
the whole
if you
circulation.
look at that and you put one body in one line, if you put align all these arteries and vein, guess how many miles they are? They are 60,000 miles.
Wow.
In each.
So if we take all the arteries and veins and make them into one pipe or one small artery or pipe, it will be 60,000 miles in each one of us.
Yeah, and
Wow.
then if you look at the distance around the Earth, it is about 24 or 25,000 miles. So each body can go around the Earth twice.
Wow.
So for the heart to pump that much blood for that long, you have to keep your heart healthy. Otherwise, when the heart does not able to pump that blood, we develop the congestive heart failure, and that's the definition of heart failure, that the heart cannot fulfill the requirements of the nutrition to part of the organ and tissue. So that's the reason we are talking today, that we need to keep our artery healthy.
And this is the normal vessel we're seeing now.
So now, if we look together, you can see that's a normal artery, and that artery can be in the heart, can be in the neck, can be in the brain, can be in the leg or the aorta. They form the same way, but with different proportion of the layers, which we will talk about today. So we have a very, very thin layer, which we call it endothelial tissue or cells. These are very important to protect the artery from any lipids or any material circulating in the blood, and it keep the artery healthy because it secrete hormones and material like heparin to prevent any blood clot. If these tiny cells, the endothelial cells, if get damaged, then that when the cholesterol start escaping from the inside the vessel to the arterial wall, and that's the beginning of the blockage, as we will see here. Let me show you here. Let us go to this slide, and this very simplistic way to see 4 parts of the artery. The first one here, the blood flow through the artery, and this is a weak area in the endothelial cells and allow the lipids pool to escape and go underneath the endothelium. Then what happens when you keep accumulating fat in that, then the capsule gets thin, and then it ruptures. When it ruptures, it forms blood clot. And then when blood clot form, to heal that rupture, there are 2 scenarios can happen. Either it will heal again, or another blood clot can form and make the arterial
makes more blockage.
And then if 2 scenarios, either this will heal or another blood clot form, and then that's where the heart attack happen and block the artery completely. So that is the reason we need to keep the endothelial cells healthy, and we will talk about that. Let me go to very important slides. I want you to spend few minutes with me here, because this cross section in
right, as we see on the slide now,
as we see, and that will add the age. So when we are children, or when we are teenager, the arterial wall is nice and healthy, but at the late teenage, if we don't watch our diet, you can see that the endothelial cells start getting a little bit thicker and some fat deposit. That's the reason we fight the childhood obesity, because the disease start in the late teens and 20s. And this was proven because when they did autopsy on the soldier in Vietnam, they were young people, and they had the beginning of the disease. So in the 30s, you start having more fat deposit in the arterial wall, but patients are asymptomatic. They don't have symptoms. Why? Because the lumen or the arterial flow is not impaired yet, but these have the blockage keep accumulating. And this, when people eat more hamburger, French fries, and pizza, all this fat, where it will go, some of it will go to the arterial wall and deposit. Then when the artery get blocked more than 75% of the lumen, then they get angina, which is symptoms of narrowing of the coronary arteries, that
Right.
when you exert yourself, you get chest pain. When you stop, it goes away. This is the simple way of the angina. And then, unfortunately, if the capsule rupture, as I told you, because several reasons, then the fat here get exposed to the blood flow, and then the blood clot will form, and this when the heart attack happens, and this when the disaster happens. So this shows you the step by step how this happens and how long it will take to cause the narrowing, which cause angina, or the blood clot, which will cause the heart attack. Before I leave this picture, I want to say why aspirin is very important for people with coronary artery disease or heart attack, because it prevents the stickiness of these platelets, and why we need to lower our cholesterol more than normal level to reduce the fat content, so you keep this capsule a little bit thicker, not stretched, so it will not break. That's the reason statin or any lowering cholesterol lowering agent and aspirin can prevent more than 50% of the heart attack. Aspirin reduce 42% of
just by aspirin alone, 42% goes
yeah,
up.
if they have coronary artery disease or prior heart attack, when they take aspirin, it reduces 42% the second one.
Heart attack.
And the
statin
also will lower it significantly.
Do you have any more slides about that part? Should we
will come to it in our discussion.
Why don't we tell the viewer what is the symptoms of coronary artery disease and what to expect if you go to the ER? But before we do that, let's go a short second break. Please stay tuned. We have lots of slides and lots of important topics to talk about.
Infidel. 8 months in solitary confinement. Interrogated. The story of honor. The story of amazing love. The story of resurrection. This is the traitor to Islam.
Hello viewers, we're back. Let's talk for 1 minute about the symptoms, and then we're going to jump to how to diagnose the coronary artery disease.
All right. So symptoms, it takes a long time, but let me briefly summarize that there are classic or typical symptoms and atypical symptoms, because females usually get the atypical form of it. But the classic angina or classic chest symptoms is chest pain or chest pressure related to exertion and improved by rest. That is the classic. Sometimes it radiates to the shoulder, to the arm, to the neck, and is associated with shortness of breath. You get shortness of breath. These are the typical symptoms. It comes with exertion, improved by rest. The atypical form, some people, they get only jaw pain, or they can get wrist pain with exertion, improved by rest. Some people, they get like epigastric pain or heartburn, and they think that it is, they ate something heavy or they have heartburn. So when you eat something heavy and you get heartburn, you can explain it. But what happens when you climb stairs and you get heartburn, that's not stomach. This could be heart. These are the very briefly what is
chest pain, whether on exertion or at rest, jaw pain, shoulder pain, heartburn, sometimes shortness of breath. All of these are symptoms.
Correct.
How do we diagnose coronary artery disease?
So we diagnose it, when I get a patient, we get the history, then we do the physical exam, then we do blood tests to check the cholesterol, calculate the risk factors. And then we do a cardiac echo to see if there is any segmental wall motion abnormalities. This means that area in the heart not getting enough blood, so you get weaker movement of that segment of the heart. Then the most important is the stress test. We have several types of stress tests. The most common one is the treadmill. You run on the treadmill, but people with abnormal baseline EKG, or if they can't exercise on the treadmill, then we do the chemical stress test or the nuclear stress test or stress echo. There are so many things, but stress test is very important.
Let's go for the treatment at the end of this episode. How we treat. We knew by now what's the reason of having heart attack, what's the symptoms, and how do you diagnose it. Let's go for the treatment, but before we go for the treatment, let's take a short break. Stay tuned. Very important for your health and your life and your heart. Dr. Malek, you'll tell us now how we treat the heart attack, the coronary artery disease, the blockage. How we do?
Yeah, the treatment is composed of three things. One is medications. So anybody with coronary artery disease or heart attack has to be on the medication.
Correct.
The second treatment, which is the most common now, we are doing a lot, is to do balloon angioplasty and put stent. The third one is to have bypass surgery, and sometimes we do combination between coronary stent and bypass. We call that hybrid procedure. But mainly for simplification, medications should be forever. Patient with coronary artery disease, including the aspirin and the statin or any other cholesterol lowering agent, plus beta blocker and other medications. The angioplasty or stent, which I will show you a couple of cases quickly, and the third one is the bypass.
Great. Let's go through the stents and see them. How we.
Yeah. So this will show you here how we do the stent. You see this narrowing here?
Very nice video.
Yeah, and then we put the balloon and the stent on the balloon. When we expand the balloon, the stent will be expanded. Then we take the balloon back, and then the stent will keep the artery open. Let us look again. So the blood here is trickling because of the narrowing.
There's
then
blockage or narrowing.
You open that, you stretch the artery, and then you deflate the balloon and remove it. So the stent will keep the artery wide open and the flow goes back. These are some of the cases I did. I was just showing how this be
nice
treated. So you see this what we call focal blockage here. This actually was a young lady was shouting and frustrated with her daughter, and then when she was shouting, she got chest pain and she came to the emergency room, and we did the angiogram and we saw that narrowing here. So we took her to the cath lab, we did the balloon and we put stent, and then this is after we put stent. You can see how nice that artery was open. This one is showing the heart attack. That's another patient came. You see that's the catheter, and the contrast does not go through the artery because it's blocked completely.
Right.
So we put a wire here. Once we put the wire, we push the blood clot. So now you can see the artery, how big that artery is, which was blocked completely here. Then we put the balloon and the stent here, as you see. You inflate the balloon and the stent on the balloon. Then after we are done, this is the new artery. So these
Brand
are
new
the
arteries, brand new heart.
yes.
Dear viewers, thank you so much for watching us. It was a pleasure time. Let me summarize in 30 seconds. We said there's a lot of risk factors: obesity, smoking, age, family history, hypercholesterolemia, diabetes, and hypertension. Please make sure you're going to work on those things and get better. Get out of your sedentary lifestyle, go to the gym, do some exercise, weight loss, follow with your doctors. We've seen the symptoms could be chest pain or shortness of breath or disabling crushing chest pain with exertion. We're seeing a lot of treatment like statin, aspirin, beta blocker, and we went through stent and open heart surgery. Dr. Malek, what would you tell the viewers in a 30-second closing statement?
All right, that coronary artery disease is very common, and don't ignore your symptoms. Know your risk factors. Don't stop your medications, and follow up with your doctor regularly.
Thank you, Dr. Malek, for a great half an hour we had. We really hope this program will be a blessing to you. And also, we wish you a healthy and happy life with a healthy heart. Thank you.